As the weather gets warmer and more people gather and mingle, CBC News has seen new data on variants in Ontario that might make all Canadians stop and think. An analysis from Ontario's COVID-19 Science Advisory Table found being infected with a variant means a 60% increased risk of hospitalization, a 100% increased risk of being admitted to an ICU, and a 60% increased risk of death, all compared to the original strain of this virus.
So you're more likely to be admitted to hospital and to potentially die from the infection, regardless of your age.
While Canadian seniors and long-term care residents are gaining protection from vaccinations, medical experts warn many younger adults working in the community remain vulnerable.
Now we're seeing many more people in their 30s, 40s, and 50s with pretty severe disease.
Thankfully, your personal risk of dying remains fairly small, so getting infected with a variant only increases your overall risk of death slightly. But with thousands of new cases every day, that adds up fast. The rough death rate in Canada right now is about 2.4%, or 24 people out of 1,000, and a 60% increase would mean around 38 people out of 1,000 dying instead.
Strong wake-up call that we're just having right now.
The head of Ontario's Science Advisory Table warns if serious COVID-19 cases keep rising, it will have a ripple effect.
Our healthcare system being overwhelmed will play a big role now in the coming days or weeks.
That prompted a warning about provinces loosening restrictions too soon from Canada's chief public health officer.
As soon as those variants take hold, things could escalate. So ease anything, and you have to be really thoughtful about it at this point in time.
Lauren, this data is from Ontario, but it is relevant elsewhere in the country.
Well, that's right. Dr. Tam was saying today that we're seeing these variants emerge in different areas. So presumably anything happening in Ontario is probably happening in different parts of Canada.
And the takeaway, Lauren, for people who may think that they're too young to be at risk?
Well, we want to maintain the same public health precautions, wearing a mask, avoiding indoor gatherings, and if you have to see other people, do it outside. Ian?
Thanks, Lauren.